come into the field and do make a good living and are able to pursue their career. Now, when we take a look at veterinary technicians as a whole in the United States, there's many different kinds of people out there. If you take one person as a veterinary technician and another person as a veterinary technician, they could have different credentials. They can be licensed as a veterinary technician in 40 different states, or they could be privately credentialed that this is a private organization that issues certification instead of a license. And then there are people who work as veterinary technicians that don't have any credentials at all. And of the people that have credentials, the type could be CVT, which means certified veterinary technicians, RVTs, registered veterinary technicians, LVT is licensed veterinary technicians, and then one state, which is Tennessee, the state of Tennessee, has licensed veterinary medical technicians, LVMTs. And like I said, some people don't have credentials at all. And the educational requirement to get these certifications or licenses could be that they have gone through a formal educational process and earned a degree from a AVMA accredited program. Or they could have gone through an informal route where they have a combination of knowledge and they can show that somehow, and they have experience and they qualify to become licensed in certain states, or they may not have gone through any of that process. Once people become licensed, they would have some kind of a maintenance requirement in most states. Some states don't require any continuing education after being licensed, whereas they can have up to 20 hours of continuing educations that is required in order to maintain and continue to renew the license. Now, the scope of practice is, I think, where a lot of the discussion focuses is what can licensed veterinary technicians do versus what can non-licensed individuals do. And that is all written in the Practice Act, which is the law that governs veterinary medicine. And in some states, there's no difference between the two people, whether you're credentialed or not, you can still do the same thing. And so that's the current status around the United States. So if we were to map this out and put it in all different kinds of patterns and colors, depending on the type of license or type of credentialing there is out there, some states are using licensed veterinary technicians. Some states are using registered, certified, licensed veterinary medical technician. And then these states that have striped colors actually don't require any licensure in order for people to practice as a veterinary technician in those states. And the state of Utah here says there is no credentialing. Actually, this is an old map that just last year, Utah has finally brought in licensures. So now they certify veterinary technicians. It's a CVT state. But you can see that they are, if you take a look at this entire picture, it's a patchwork. It's like different kinds of certifications and credentials that are put together. And so there's actually, that's turning into an issue that veterinary technicians have different titles depending on where they work. They have different tasks that they can perform, so it's not consistent. If you go state by state, it's not the same. And in terms of some states, there's actually no legal existence of what a veterinary technician really is. And so there is an effort called the Veterinary Nurse Initiative. On the bottom right over here, that's their logo. Veterinary Nurse Initiative is an initiative that is taken on by the National Association of Veterinary Technicians in America, or NAVTA, that they are trying to take this patchwork of different kinds of credentials in each of the states and turn it into a singular consistent, because it still has to be done in each of the states. It can't be a national licensure because that's not how things work in the United States. But trying to turn all the states into issuing registered veterinary nurse credentials and having the same requirements, and they do the same things. And so there is a move towards taking these veterinary technicians and turning them into veterinary nurses, and that's our goal. There's many different reasons that go along with that. But one of the biggest reasons is that the word technician really symbolizes people who have the knowledge in the science and technology, and they work on things, mechanical things mostly, that are more task focused. So if you think about an X-ray technician, that's a person that knows how the X-ray machine works and takes X-rays. That's just an example. But our role has changed to the point that we truly believe that we should be nurses, that we are taking a look at animals, we're looking at patients, and we're taking into consideration the family and doing things like assessing the patient's status, taking a look at what their response is to treatment, to be able to put together information and come up with recommendations and plans in order to help the patient to become or to be healed from the issues that they have, the problems that they have. And so our role over the past 60 years has evolved to the point that we consider ourselves nurses now. So there's an effort to try to change that. Another thing is that our profession has always suffered from not having a whole lot of public recognition, that the pet owners don't know who we are or what we do. And so the title veterinary nurse really allows people to understand what our role is. And by doing so, we can create a good, distinct identity within the veterinary team. And veterinary nurse is actually what the rest of the world is using. Aside from Canada and the United States, the vast majority of the rest of the world uses the title veterinary nurse. And so that's one way to think about it, in that we want global standardization of what the profession does. Now, the road to being credentialed, regardless of what we are called, starts with people going to an AVMA accredited program to obtain an associate's or bachelor's degree. Associate's degrees are usually 2 years to obtain. Bachelor's degree takes 4 years to obtain. But once we have that degree in veterinary technology or veterinary nursing, we can now take the VTNE exam, which is the national examination. And once you pass that exam, there might be a state-specific exam that different states have different requirements. And I mentioned that that's actually a problem. But some states have specific exams. And once you pass that, you're able to register with the state veterinary medical board. Veterinary medical board is the governing body for each of those states, and they issue licenses or certifications. And as I mentioned, there is also continuing education courses, classes that people need to take to renew their license. And that's how it all works. And the common question that comes up is, should veterinary technicians need to be credentialed? And why does it matter? What's the value in it? And so what we believe with that is that being able to have people go through a standardized way of becoming credentialed means that you're going to have a standard level of knowledge that these individuals come with. And it really turns a person who is just doing things into thinking individuals that know the reasons why we are doing things and why we do it in a certain way to make sure that we are doing the most benefit to the patients. And that allows us to know how things can go wrong, that when something does go wrong, how do we troubleshoot that? How do we fix the error that occurred? Those kinds of knowledge comes into play. Ultimately, people who have education is going to lead to better patient safety, better outcome, and we're going to be able to do our jobs better, which is all what we all want to do. So what do these individuals do, right? That the credentialed veterinary technicians, what are they able to do? What are they allowed to do? And how does the credential play into it? Is what the scope of practice conversation is about. And so when we think about veterinary technicians, there's so many different things that we do. You can see from graphics like this that we serve as a nurse. We provide anesthesia. We might be an X-ray technician. I don't really like, maid, janitor, like, cleaning and things like that. That's something that doesn't require the education that we go through. And so I don't necessarily agree with this part of this, but you can see that there's all sorts of different characteristics, different tasks, different qualities that people in our profession need to have. And in order to do that, or what that allows us to do may be something as simple as this, which is subcutaneous fluid administration, or nursing a neonate as they are having trouble growing. Or it could be something like placing an IV catheter in a patient that has very stubby legs and loose skin. So it's hard to place an IV catheter in. So somebody who is more skilled needs to come and place a catheter in the lateral saphenous vein. Or it could be that we're placing a bandage on a patient that has just recently received a fracture repair. Or it could be that we have an emergency situation where the animal has ingested anticoagulant rodenticide, so rat bait, that is going to bleed out if we don't get that out of them. So we induce emesis or make them vomit. And then follow that up with activated charcoal, which absorbs the toxins from the stomach so that less of it gets absorbed by the animal. Could be that we're placing an IV catheter in an emergency patient, drawing some blood out of it very quickly so that we can start some blood work. And while that's running, we're finishing placing the catheter, delivering a fluid bolus to stabilize the patient, and moving on to more emergency stabilization treatments. And as they become more and more critical, you'll see things like this happening where there's actually 10 different kinds of fluids going into this patient because they're critical, and we're monitoring all of it in terms of the rate, the dosage, the response of the patient. And we call this the tree of life in the ICU. And it could be something like placing a nasogastric tube. And then taking an X-ray to confirm the placement to make sure that it truly is in the stomach. It may be that we put together an anesthetic protocol and draw up all the anesthetic drugs that need to be delivered or administered to the patient to provide general anesthesia, placing a patient on a mechanical ventilator to maintain good oxygenation and ventilation during surgery, and being able to do that for so many different species. It may be that we are performing a cross-match, which is for compatibility testing for blood products. And once we know that it's compatible, going ahead and delivering that transfusion while monitoring the patient. It could be doing things like thoracocentesis in order to evacuate pleural effusions that is making the patient have difficulty breathing. It could be that we maintain a patient on a critical care ventilator, a long-term ventilator, where we're spending days up to weeks taking care of a patient that requires ventilatory support and all the nursing care that surrounds it. Could be that we're placing a urinary catheter in a female dog, maybe placing an arterial catheter in the ear of a patient that's going to need serial blood gas analysis. Monitoring a patient that has respiratory issues in oxygen, doing an ultrasound exam, whether it's for collecting urine samples through cystocentesis or evaluating whether there is fluid in the abdomen, things of that nature. Maintaining a patient with a thoracostomy tube. This is a dog with a pyothorax, an infection in the pleural space, the chest cavity. Resuscitating a neonate that comes out from C-sections may be another one. And then when we have time, teaching a dog feline internal medicine. And this is obviously just a joke slide, but I kind of put that in there because you can see that a lot of the things that I just mentioned previously is very intense things. And we spend a lot of time and energy working on animals, especially in emergency and critical care, that may not even go home. And so there's a very strong emotional component to being a veterinary technician, veterinary nurse. And we also need to make sure that we take care of ourselves. So laughing sometimes is definitely needed. And so we often think about what makes a veterinary technician amazing. Like what does a super tech do? And there's two different things to consider. There are the hard skills and the soft skills. Hard skills are the things that are more uh, ability in nature. Like hard skills are things like nursing skills, technical skills, the ability to keep records very well, the ability to perform math. And so these are things that we kind of associate with our ability to perform certain technical tasks very well. And then the soft skill side is things like the ability to communicate, emotional intelligence. That can we tell each other, like, what the other person is feeling, how we are feeling ourselves, personal leadership, and the ability to work as a part of a team. And both of these need to be very good in order for somebody to really take off and rise to the occasion. And so many things that we could be doing. This is an emergency surgery, hemoabdomen patient that has a splenic mass. So a spleen has ruptured and the animal is bleeding into the abdomen. So we have to stop the bleeding by going into surgery. Placing a snake on general anesthesia so that we can remove a large mass here that is sticking out. Placing an IV catheter in a very small rabbit that is tiny, or maintaining an IV catheter without waking the animal up by going down on the floor ourselves. Placing patient arterial catheter in the ear of a patient, nasogastric tube. This is a patient that's on mechanical ventilation that needs long-term care. And when you take a look at a photo like this is the veterinary nurse here. And she is the one that is taking care of the animal through various means, while the veterinarian, the doctor, is able to come and check in and make different kinds of orders for treatment, and doesn't have to be there all the time in order for the patient to be taken care of. And you can see that the doctor is very happy because the pulse oximeter reading is 100% for this respiratory patient, which will allow the patient to live until they heal from whatever issue that they have. So what does a veterinarian do versus a veterinary technician? And veterinarian would be the people that do the diagnosis, prognosis, prescribe treatment, and perform surgery. And only licensed veterinarians can perform these tasks, and that's by law. Now, what does that mean for the veterinary technician? That means that the veterinary technician could perform everything else with supervision, that the veterinarian provides a supervision, and they should be able to do anything aside from these tasks. But you will find that in various states, there are laws in place that only allow licensed individuals to perform certain things. So if you're not licensed, sometimes you can't do everything. And an example of that is California. California is a state that says that veterinarians can perform surgery, diagnosis, prognosis, and prescription of drugs. An RVT, or registered veterinary technician, can perform things like inducing anesthesia, applying cast and splints, performing dental extractions, suturing cutaneous and subcutaneous tissues, so surface tissues like skin and such, or gingiva, and creating a relief hole in the skin to facilitate intravascular catheter placement. Those are things that is considered the scope of practice for RVTs, registered veterinary technicians. They also say that unregistered assistants, or people who are not registered veterinary technicians, are prohibited, meaning that they cannot perform those tasks that I just mentioned. So unless you have the license, more and more states are moving towards restricting what unlicensed individuals can do. Another example is New York State. New York State also says that these things, and I won't read all of them because it takes a little bit of time, but you can see that there are many different kinds of procedures that only licensed veterinary technicians can do. When we take a look at unlicensed individuals, and this is where it says unlicensed person may provide supportive services, such as administering oral or topical medication, but not much more than that. And so unless you're licensed as a veterinary technician in the state of New York, you really can't do a whole lot. And then those are two states that are probably the strictest and have some things that unlicensed people can't do. There's also an organization called AAVSB, or the American Association of Veterinary State Boards, that put out guidance documents. These are documents that each state looks to see how they should modify their laws, how they should progress in terms of regulating the licensed individuals. And so they recently published a document called the Model Regulations for Scope of Practice for Veterinary Technicians and Veterinary Technologists. And so this is a recommendation that they're making that people, these certain tasks should be restricted to people who are licensed. And I summarized this. There's a lot of information. I know on your handout, this is a new slide that I put together, so you don't have this, but we'll definitely make sure that you have it after the session. There's 3 different kinds of supervision that veterinary technicians can function under. Immediate supervision is when you're right there. You can talk to, the veterinarian can talk to the technician and watch what they're doing. Direct supervision is when the veterinarian, the doctor, is in the same building and may not be able, they might not be in the same room, but they are in the same building, and so they're very easily accessible, easily reached. And then indirect supervision is where the doctor might not be in the same building, but they can be contacted by phone, by video chat. The doctor left written instructions on what to do. That's indirect supervision. So immediate supervision, where the doctor is right there in the same room, veterinary technicians can assist in surgery. So that's what this person is doing. Might be holding tubes, might be holding organs, intestines, things like that. They will also be able to place invasive tubes like chest tubes, abdominal tubes, and even stomach tubes can be placed if the doctor is right there. Direct supervision, so when they are in the same building, but maybe not in the same room, they can perform things like anesthesia, blood transfusions, different kinds of dental procedures, non-invasive tube placement. So these are things like nasal gastric tubes, for example, or nasal catheters. Being able to suture skin, or placing invasive things like intraosseous catheters. These are catheters that go into the bone. And then indirect supervision would be where they are able to provide different kinds of medication, provide fluid therapy, provide monitoring, perform some of the diagnostic imaging, like taking x-rays, doing ultrasound exams, MRIs, CTs. Sample collection, whether it would be urine sample collection, blood sample collection, skin scrapings, different kinds of things, and also emergency procedures that if the animal's life is in danger and the animal may die, veterinary technicians can do a lot more to try to save the animal, even if the veterinarian isn't right there, and that all makes sense. And so that's kind of the summary of the types of things that veterinary technicians can do. And so on your handout, you have all this information. I'm not going to spend time going through it so we can spend more time discussing things, but through the slides, you will see exactly what they say. And there's a lot of details on the different kinds of things that veterinary technicians should be able to do, or should tasks that should be restricted to licensed individuals, depending on the level of supervision. And so let's stop here a second and have our first discussion. So I'll turn it over to Ms. Yamamoto.
先生、お声ありがとうございました。アメリカでは今現在どのような状況で、動物看護師がどのようなパシージャーをして作業ができるかということをご紹介いただきました。どんなことができてどんなことができないということも、クリアになっているところもあるというところなので、今後日本でも国家資格化になっていくと、アメリカと同じような有資格者ができること、持っていない方ができなくなってしまう業務もあるかもしれないんですけれども、今後、日本で国家資格化になった上で、どのようなことが考えられるかということを、これから先生方にディスカッションしていただきたいと思っております。 まずですね、私の方でディスカッション、ブレイクアウトセッションというものをですね、作らせていただきます。画面を共有します。
その前に一つ質問なんですけど、イミディエートスーパービジョンってあれはどういう、あれなの？ダイレクトとインダイレクトはわかるけども、イミディエートスーパービジョンっていうのはどういう監督下のもとでやるわけですか？
イミディエートスーパービジョンというのは、すぐその場に、先生がいる。なんていうんですかね、声をかけられる距離というふうに言われてます。
OK、わかりました。ありがとうございます。はい、
あと一つ、太田先生からご質問いただいてましたね。日本では動物看護師を VT でなく VN と呼ぶようになっていますが、アメリカでは今、どのような呼称というか呼び方でされているんでしょうか。
はい。法律上では、今、ベテナリーテクニシャンという、名で、書かれてます、法律上。ですけど、それをベテナリーナースに、変えようとしている努力があって、全国全体で、そのように変えるように、努力しているところです。で、仕事場とか見てみると、ベテナリー、ナースを使っているところも多くなってきてますし、その学位、ベテナリーテクノロジーの学位を持っている人たちが、一番多いんですけど、そのベテナリーテクノロジーのプログラムの方もベテナリーナーシングのプログラムに名前を変えるようになってきているので、230校のうち、12校今、ベテナリーナーシングに変えたところです。ですから、徐々にベテナリーナーシングの方に移っていってるんで、その、何年か経つにつれてどんどんと変わっていくと思います。で、そのうち法律も変わると思います。ベテナリーナースに。
ありがとうございます。
ありがとうございます。はい。それではですね、ブレイクアウトセッションに入らせていただくのですが、これからですね、私の方で操作をしまして、ブレイクセッション A と B というチームに分けさせていただきます。その際に、このようなポップが出てきます。今すぐ参加するとか、参加は、スマホとこれ PC の画面なんですけども、参加しますというところをクリックしていただければと思います。で、15分のディスカッションをさせていただいて、で、その後、また15分、メインの方に戻っていただいた後に、各チーム、5分程度で、どのようなお話をされたかということを発表していただきたいと思います。こちらですね、What will change ということで、どのような変化が起きるでしょうかというところに関して、2チームでこれから議論をお願いいたします。それでは、ブレイクアウトセッション開始しますので、よろしくお願いいたします。